Hey everybody, it's Dr. Joe, and today we're going to talk about ultrasound therapy. And the folks at Shophysio sent me their Sonopulse III by Ibermed. So let's get started. Disclaimer alert! Disclaimer alert! So what is ultrasound, you might ask? Ultrasound is basically sound waves, but it's not actually like the ultrasound where you can see pictures. This goes deep into the tissue, and you can have 1 megahertz or 3 megahertz. And 1 megahertz goes a little bit deeper, 3 megahertz stays a little bit on the surface. But ultrasound can help with a whole bunch of different things like pain relief, it helps reduce muscle spasms, even joint contractures. It does a really good job of also increasing circulation to the area. So I really like using it for things like tendonitis and bursitis. Depending on what clinician you ask, they might not have a whole lot of happy thoughts about ultrasound and just saying, I don't know if it works or not, but I've really found that it has some really good results for me as well as my patients. So that's why I want to talk about it. And the reason I really like the Sonopulse III is because it's super user-friendly to use, but this is a professional unit. So this is for clinicians out there, therapists, chiropractors, other healthcare professionals, even with aesthetics. You can use it as well. So you wouldn't really want to get this for home use, but stay tuned and listen to what you can really use it for and how it can benefit you. So then you can ask your therapist about it for using it. So as you can see here, there's not a whole lot to the unit. There's some select buttons, some set buttons, up and down for intensity, your program, your menu, and your start stop button. And so what's really great about that is some units in the clinic, and if you're a clinician, you know that it has like 20 different things on it, and you have to set this and that. It takes a long time to program it, and sometimes you're spending 5 minutes before you're even getting started with your patient. And so this I really like because it's super simple, it's pretty easy to use. There's the couple options that you put in, and then you get started and get going with it. So I want to kind of show you how you can use it, and I'm going to plug it in and we'll get going. So as you can see here, I'm going to turn it on in the back, the on button's in the back, and it just kind of beeps and comes on and has the display up front. And so again with ultrasound, the nice thing about this is it has the 1 megahertz and the 3 megahertz. And usually the 1 megahertz is what in the therapeutic setting we'll use because that goes a little bit deeper into the tissue. So again, for me, the biggest things like tendonitis and bursitis, where you really want to get increased circulation to that area, this is a great way to do it with ultrasound. Because sometimes you can get it moving with stretches and exercises, and that's great, but sometimes it's just not quite getting that increased circulation or that deep heat to the area to help loosen things up. And ultrasound it's a pretty pain-free way to do it as well, but you really want to make sure you have the right settings. I think sometimes that's why the research is kind of mixed on ultrasound, because people don't set it on the right parameters, and if you don't have the right amount of watts per centimeter square or things like that, then you're not going to get enough of the increased circulation in the area, and it won't be quite as beneficial. So just make sure that if you're a new clinician and you don't know all the parameters, read the manual, make sure and research, do some research studies, reading them to make sure that you have the right parameters. So usually for me, I like to use the 1.0 megahertz, which goes a little bit deeper, so it's more of a narrow wavelength going in, versus the 3 megahertz is wider, so it's a little more on the surface area. So you can use either one, but again, if you're going kind of deep down into those tendons or the bursa, I like to use the 1.0. Then you have the watts per centimeter square, and that's really just kind of the intensity of it. And it's really easy here. You can just go up or down. This is where you need to be a little bit careful, because the higher you go, it is more intense. So a lot of times I'll tell my patient, I like to usually start at about 0.8 to 1.0. And if I just say, if you feel like a deep achy kind of pain, let me know and I just need to back off. So depending on what area you're on, you can go a little bit higher, but that's kind of the range, maybe 0.8 to even 1.2, but usually I don't go much higher than that. And you might have to go up and down as you go. Usually what you'll feel with it is just kind of a warmth as you get going. Sometimes it's cold in the beginning because you have to use a gel with it, a conductor gel, and so you can get any universal conducting gel to go with that, but you do need that for the ultrasound, and this unit doesn't come with it, but you can use any kind you want. And so you'll feel the gel first, and if it's not heated up, it's a little cold, but then it'll get warmed up. And sometimes you'll feel a little prickly tinglies as you go, but it shouldn't be painful. That's the big thing. So you can see the different settings here. So frequency is the 1 megahertz or the 3 megahertz. And once the little arrow is on the frequency, you just set it up or down, which will be the 1 or the 3. And so again, I usually like 1 the best unless it's other things. And then if you go down to the timer, it's anywhere between 1 and 30 minutes. I usually like to stick between 8 to 10 minutes with my ultrasound treatment, but again, depending on what you're using it for, you can use it for different things. But I like to just kind of use that to warm things up and then do stretches and exercises as well afterwards. So not just using it by itself, but using it in conjunction with other things. Then you have the pulse frequency, again, which is the watts per centimeter square, and you can go up and down with that. And then you also have the duty cycle. And what the duty cycle is, which sounds kind of funny, is how much percentage is going in. So you can do continuous, where it's getting that wave the whole time. You can do pulsed, which is you can do 20% or you can do 50%. So if somebody's really tender, really irritated, you might not want to do the continuous the whole time. You might want to do it much lower, which is just 20% of the time it's on, or you can do 50%, which is 50% of the time it's on. But you're moving the ultrasound head or the transducer the whole time. So if you're doing a 50% or 20%, make sure you're going slow so you can get the whole area. But if you're going continuous, you want to make sure it's moving the whole time, because if you stop, it does kind of then get that achy spot, because then it's just going in one spot. So you want to make sure you're moving it the whole time. And so what's also kind of neat about this particular unit is it does have a sensor on it where it can sense if the skin is getting overheated or an over temperature, and it will actually automatically stop and beep at you. So like if you're holding it in one spot and it's getting too hot, so all it does is it will pop up saying over temperature. Just keep moving the head, and then once it kind of can tell that it's not so hot anymore, the unit will start back up again. So that's really cool as well. And then also, if the actual ultrasound head isn't plugged in, and like maybe if you have it unplugged or something, you start and you don't know it's unplugged, it will also let you know that it's not in and that you just need to plug it in. And so it'll give you a little equipment without the transducer as well. So that's pretty neat. So then you're not doing the whole treatment and not actually getting anything, since usually you don't feel a whole lot of stuff. So again, I'm going to kind of show you, let's say I had a little lateral epicondylitis or tennis elbow going on right in here. And so you want to, again, make sure you're using a conducting gel, because otherwise it won't work. It needs that gel to be able to get through without burning or irritating the skin. So I usually, let's say more is better with this. So make sure you have a towel or something. And I'm just going to put, I usually like to actually put it on the head instead of on the skin, but sometimes you can do a little bit of both just to make it easier to rub on. And then so before I would put it on somebody, I'd go ahead and set my parameters. And so once I get everything how I want to, and I'm just going to do maybe like a 0.8, then when it's ready to go, you've got the stop button here. And so usually I'll go ahead and start moving it around and then hit the start stop button. So if I'm right here, I'll go ahead and kind of roll that gel around so it's in the area that I want, and then I would start the button and go. And so it beeps at you a little bit, and then once it's going, it shows that little waveform going through on the top there. So if I just leave it, it's going to get a little bit uncomfortable. So you really want to kind of do circular motions, or even kind of, I do figure 8 motions around the area. But the big thing that I like to do too, which is just another treatment component, is some people just kind of lightly rub it around like this. I like kind of getting a massage in there too. So I'm really kind of pushing down, so I'm almost getting some adhesions out by doing some scar tissue moves as well, just with the transducer head. So you can do some firm pushing as you want to get that double component, or just kind of moving it around lightly is fine too. That both ways are going to get those waveforms into the area. But if you just want to kind of do a double treatment, just kind of push it in there as well. And so I can already feel that it's getting a little bit warmer, and then there's sometimes every once in a while, depending on what kind of injury you have, you might feel little pricklies and stuff, and that's just it going down into the tissue and doing what it's supposed to do. And at any time you can hit the stop button, so that's pretty nice as well. And you can go back, to your programs if you want to, where you have user 1, user 2, and then you might already have your program in there. Or if that was too much for your patient, then you can go down to a pulse, which is like the 20% or the 50%. So again, the ultrasound has a lot of great components to it to help with the healing process. It's usually not my first line of defense, but if somebody still has a lot of irritation and pain and swelling in there, and it's just not getting out of there, and it's like a tendonitis, bursitis, ultrasound is a great alternative to try and see if you can just really increase that circulation, break up that inflammation and move it out of there that you might not be able to get to with just traditional manual work. So it's a great other option to have. So if you are someone who might need it, make sure you go ask your physical therapist about it. If you're a clinician looking for it, I think this is a great product because it's super simple to use. It's very effective to use. Again, you can use it, for pain relief, even those joint contractures, increasing the circulation, decreasing spasms, and things like that. So again, this is the Sonopulse III by Ibermed, and so Shophysio has a whole lot of other professional products that you can check out. Anything ranging from physical therapy to aesthetics and athletic training. So make sure you go check it out. Again, these are for professional use, but if you see something that you're interested in, you can ask your healthcare professional about it. So if you're interested in purchasing the Sonopulse III or any of their other stuff, make sure you click on the link up there, and don't forget to subscribe by clicking down there. And remember, be safe, have fun, and I hope you feel better soon.